last year. Goodness, thank you.
Good evening, everybody. I'm calling to order the regular monthly meeting for May 20th, 2024 of the McHenry County Board of Health. I'd like to ask that roll call be taken, please.
Mr. Markison? Dr. Amsler?
Here.
Ms. Carmen? Ms. Althoff?
Here.
Ms. Gaffney?
Here.
Ms. Morawski?
Here.
Dr. McGuire? Here. Dr. Katz?
Here.
Ms. Ortiz? Here. Ms. Clark?
Here.
And Mr. Clark?
Here. Any public comment this evening? Hearing and seeing none, we will move to item number 3. With Cecilia being absent, would any member be willing to?
I'll make a motion to approve the minutes as presented.
Second.
The motion has been made by Ms. Althoff, seconded by Ms. Gaffney. Any discussion on the minutes from last month? Hearing and seeing none. All those in favor say aye.
Aye.
All those opposed say nay. Ayes have it, motion passed. Next item of business is employee recognition. You want me to?
Open the review and request staff give the directors.
The first employee that we'd like to recognize is for 30 years of service to the county. That is remarkable.
Oh, wow.
Concepcion, Montana.
Annie Montana works in the nursing division. She's an administrative specialist. She's worked in many programs, and she is, for 30 years experience, is that great historian, does a lot of training and onboarding of the new employees coming in. Priceless.
Yes.
So was she 17 when she started? Really?
That is remarkable. Well, Miss Montana, congratulations on 30 years. I hope you stay for several more. Thank you. Back to you.
Thank you.
The next employee has been with the McHenry County for 25 years of service, another remarkable achievement. Congratulations to Jeffrey Lovato, and we'll turn it over to Patty.
Yeah, so Jeff works in the Division of Environmental Health. He started actually as a student intern from Illinois State, and then he came on board, and he's actually one of our field staff supervisors. And Jeff is actually, he's just the cornerstone of our potable water and our private sewage programs, and has been for numerous years, and his technical knowledge is really unmatched, and I think that's recognized both in the department and outside with all the people that he works with. He's just a joy to work with.
For those of you, Jeff was here in absence of Patty a month or so ago. If you want to put a face to it. Thank you, Jeff, and congratulations. Division, or department and division updates. Let's start with Melissa.
First, did everybody, I sent an email recently, trying to get on everybody's schedule. So a few of you, thank you very much, have already scheduled. I've sat down with a few of you. This is not to chastise anybody.
I read it, I thought about it, and then I'm responding.
I was not calling anybody out. I was simply making a friendly reminder. I would appreciate, it's not required, but would love to sit down and pick your brains. So if you have time, I mean, if you've got 30 minutes, we can do it in 30 minutes. If you have an hour, you know, whatever it takes. Second, we are going, just a FYI for future meeting, we are looking at updating the ordinances. Patty has kindly put together a schedule for us, so We're targeting roughly about August at this point to bring some changes before this board, before it would have to get on the county side. So to do that, we have to do public notification, get input, all of that. So we're gonna start that process very shortly. And then finally, just an update, we are, as part of workforce development, we are signed up to do a number of either like national workforce surveys, and also a statewide process called the Capacity and Cost Assessment. This has been done in other states. We have gotten some orientation thus far. The point of it is really, it's a framework for us to look at how the costs to deliver foundational public health services at the level that they need to be implemented. So what it's going to be looking at is whether or not every health department, and we're trying to do this statewide to get every department in the state, and that's important because it helps have a very solid database of information to bring back to the state, and we can compare and contrast ourselves. And so whether or not we have all the resources we need to deliver those services, and any gaps between the current and full implementation of those services, it's extremely detailed. It's going to take about 14 weeks for us to do, and we will update you as we go. The analysis is going to happen through the University of Minnesota. Minnesota has done it, Washington State has done it, and several other states, but they present it to us at a state level. So it's an exciting thing that we can kind of put a dollar amount to what we're doing and what public health needs, right? If there is a gap between what we're expected to do and what we, let me see if I want to get this right, that there's sufficient funding to do the things we are required to do. So it's going to point out if there are gaps there. So just want to give you a heads up on that because it's going to be an in-depth undertaking. It's going to take a lot of staff time.
Sounds good.
Okay, very good. Any questions or from the board? Next will be Director Noem.
Okay, just a couple things. The Illinois Department of Public Health just recently adopted the 2022 FDA Retail Food Code. We're currently working under the 2017. So they will be holding some meetings over the summer. So there are always updates with every version of it. So as we go through the ordinance update process, we'll be incorporating any necessary changes we need to make sure that we are up to date. Implementation date for local health departments is January 1, 2025. Also, the EPA has selected a household hazardous waste vendor. They were working on that previously. So they will be moving forward with household hazardous waste events again this year. We have applied to be one of the hosts for that. I hope that that will happen. And so we should have one, I think, in September or October of this year. And then finally, this is something Melissa had asked me about implementing last year, and we've been working toward it. So next week, we're going to start our virtual office hours, which is a project in our food program, and it's going to be open to all of our food establishment operators. So it'll be broken up into a short training session, and then just a question and answer session. So it's something that's done at the state health department. We participate in it, and then it's done at other local health departments too, and it's been successful. So we're excited about it. That's it.
Questions, comments? Director Karras, please.
So Operation Dropbox, we're getting filled to the rim with some donations. We have a record number this year of 87 donation sites throughout the county, and it's really turning out to be quite the job to pick up, and we've already almost had one of our rooms filled, which is awesome. We're super excited about that. Our COVID dashboard will be discontinued by the end of this week. We'll be pulling that down, the end of the respiratory season. We are still, just because we're not putting the dashboard up there, we are still monitoring that. We're hoping to have our new Metopio dashboard up and running by the next respiratory season, which will show RSV, influenza, and COVID. So that's the goal. The new IDPH surveillance system that's being rolled out, the first release will be coming out on July 15th for just the STI and TB modules, and all that training will be starting in mid-June for staff. I just wanted to share a big shout out to our WIC program. They had their third quarter numbers come in and they have exceeded all goals for their breastfeeding. They have just progressively increased throughout the year each quarter. So super proud of that team and under the leadership of Zach. Avian flu, watching that extremely closely. We are staying in touch with the state, keeping up on what to the, measuring our capacity, getting ready for the potential case here in McHenry County. So we have been working with state, filling out our capacity assessments. We are looking at Tamiflu. We do not have any Tamiflu in stock. We can request it from the central dispensing, CNS, if we get a case. But we kind of want to have some on hand so that we can start treatment immediately, because the recommendation is 24 to 48 hours for any contacts. So we're trying to procure a small amount of that so that we can get the ball rolling while we wait for those supplies to get to us. So that's kind of where we're at.
Dr. Amsler?
Question, this kind of goes back to something we did earlier, and that is, do we do anything extra for the employees who have been here 25 years or 30 years?
Do you want to talk to it?
So yeah, we have our employee recognition committee, a new committee that we formed specifically to look at this. So now we've talked to the auditors and we've gotten approval that people that have been here 5, 10, 15, 20, 25, 30, we have a booklet of items they can go through and pick out a gift. And with each milestone, the number gets higher and higher. And certainly the auditor's here, so no, it's not $1,000 or anything like that. And so we're working with all the group that we just announced tonight and the previous group to get a booklet going. They've already picked out some gifts, and then we'll have a finalized booklet probably in a couple of months as they work on that and group that. Here's your 5-year reward, you can, what you can choose from. So we are working on that.
Is that separate from what we approved? Was it a year ago or so?
Mm-hmm.
Well, that was the funding for it.
Yes.
We
That
approved
was the funding for it,
well,
or is it
that's where they're
separate?
getting the funding from,
Oh, okay,
is from what we approved.
okay.
Thank you. Is it only gifts, or is there an opportunity to get like a gift card as opposed to?
Gift cards, no.
Okay, that's why I'm asking, because the auditor's here.
What we are trying to do too is look at a program where we're gonna do kind of an all-staff meeting and maybe a retreat and have a guest speaker there, someone, a motivational speaker, wellness speaker, something like that, that the entire department, it's
Nice.
department-wide and we all go and it's kind of a day of, meditation, relaxation, and everyone together, so we're trying to plan it.
Can I join your department?
But the auditor's here too.
How many people would that be for, just out of curiosity?
I'm sorry?
How many people would that be for?
Right now, I think we are at our staff level of 116.
I had an idea, but not for that many people.
Your house?
Little farm.
No, no one wants to come there.
Team building event.
Yeah, there you go.
There's a retreat center on the lake, but I don't know if it could have
Yeah.
that many people.
Let me know where.
Okay.
I'll call.
I'm sorry.
Sorry, that took a turn. Yeah. We were talking about Tamiflu.
Are we done? Any other questions or, any other questions or comments? Director Howell?
Yes, as you may recall, I was going to the first Animal Control Summit for the National Animal Care and Control Association. We had representatives from about 34 states. I went with another person on the Illinois Animal Care and Control Association board. And it was very telling, but I wasn't surprised at very much. So a few things that we talked about there. We talked about trends. We're all seeing an increase in relinquished animals. That's just what's happening. We are specifically seeing an increase in 2, 3, 4-year-old dogs coming in, whether they're coming in as strays or they're coming in under relinquish. Sometimes they're coming in as strays, and then we're learning who the owner is and helping them to be responsible. Along with that is longer stays in-house. Longer stays in-house lead to more behavioral issues, which leads to harder adoptions. So adoptions are down, intake is up, and I think nationally we're all just trying to work on that and come up with some solutions for that. So we're meeting our community needs. Things that we are looking at for in the next year or two, we're looking for positive community engagement. So how can we keep animals in homes? What kind of resources and partnerships should we have that we don't already have? I'm talking about a national look at these things. Standardizing trainings for animal control officers, which we already have some of that. One of our officers may very well get to participate in the first ACO 3 course that NACA has ever offered. It's going to be at the University of Florida, their forensic department, so that would be very interesting if we are chosen to do that. They're doing it in July, and they're only going to be having maybe a group of 10 cohorts on that. We may very well be lucky enough to have one of our officers go. We want to standardize the equipment that officers have and what the officers need to get their job done. We're looking at a national database depository for field activities. Right now, we have a lot of data on shelters and rescues, but we don't have a lot of national data so we can look at more of the trends in the field, our officers going out in the field, and what kind of things are we seeing in the communities. For us, our court case dogs are going up. We're holding owners accountable for a number of different activities. And so then we are taking up some of our space with relinquishments and then court case animals. We have closed out 2 cases, one where we're going to be trying to transfer that dog to a rescue if we can. We have a rescue that's very interested. And the second one, the owner just relinquished today. I think that dog's going to be an easy placement. We probably, when we have court cases, we typically try to move them out of state or out of county, just so it's easier on the owner and easier on the animal. We do have an admin specialist position open. We've been actively doing interviews. I think we'll probably do our second interview next week. We have one ACO position that we just filled. That person's going to be starting next Tuesday, so we're excited about that. We have the 2 positions that you have on the agenda today. One of them is taking an ACO position to create this other position, and then when we bring up that resolution, I'll talk a little bit about the change there and sort of what it looks like overall for animal control. Was there one more thing I was gonna, we did work with nursing on some educational information for H5N1, sorry I said it incorrectly, and because I was gone last week, Susan and I will probably touch base this week to see where we're at with that. But I think we're close to having it done, so. And that's where we're at.
Questions or comments from the board?
I have a question. Excuse me. I may have completely missed the talk, if there has been any talk about planning for the development of the area. You know, they're talking about redoing your buildings.
The renovation?
Yeah. Are they gonna add more kennel space?
We are not gonna add more kennel space right now. What we really need right now is to open up some of our spacing for our staff and equipment, so that we can utilize some of our kennel space a little bit better.
Do you guys have outdoor fenced-in areas for dogs?
We have 2 outdoor fenced areas with the renovation. We may have to get some more green space, so we may get another one. The one thing that I think we need that we just cannot get done right now is the outdoor runs.
Yes.
When you have court case animals, you have to be very careful about having nobody get injured, but you still want them to provide them that social interaction, which you can do in a kennel, but it'd be better to have a run to get some of that energy out. Especially because a lot of those dogs are working dogs.
Okay, thank you.
Anybody else? For those listening to the audio tonight, board member Markinson has joined the meeting.
1,000 apologies.
And no donuts.
I'd have been more late.
That's all right. We don't care.
Director Marin?
Thank you. So we did meet with the architects from Kluber today on the Crystal Lake Facility project, and they presented us with some draft drawings. So we did request some changes. They're gonna go back and make some very slight changes. They are within budget, so we're very excited about that, and that includes all the soft buys, such as your furniture, carpeting, decorations, and things like that. And this is starting to get kicked off, so we're very excited. It looks really good. I think Mary Ellen and Susan both were pretty happy with what they presented. And with those slight changes, we'll meet with them again and then come back with you to show you what the final draft will look like.
Can I ask a question on that? May I ask a question on that? What about there was some discussion at the county board about the drive-through, using it for animals and people.
They have a solution
They
to
do
that
have a
that they
solution
have
and it's still
presented.
within budget?
Yes,
Thank you.
so they have presented that as a draft, so we're excited. We'll, like I said, once
Excellent.
we get these tweaks done, we'll bring it back to the board. The Crystal Lake camera project was also completed last week. We installed 12 outdoor cameras and 3 indoor cameras. These cameras were either replacements for existing or brand new cameras where we couldn't get film anywhere for safety reasons. So thank you to Director Howe for working so closely with IT and helping get this together, and Janelle Carlson for being there during the week of installation, which I'm sure was pretty crazy. So thank you to all the staff there for putting up with that. We're continuing to provide a lot of staff training, everything from leadership to time management. With the Carol Keller Group, we had gone out to bid and they were selected. They're a great group. We're getting incredible feedback for how good these trainings are from all the staff. This too is part of the COVID crisis grant, just as the camera project was, so we're winding down that grant. The training to Carol Keller Group is through the end of June at $24,000 on the grant. So we're very excited about that. And to get that wrapped up and all the training done. And that's all I have.
Any questions or comments from the board? Thank you. Manager Dietz.
I just have a couple things. So last month I had mentioned that IDHS had completed their audit or was in the process of completing their audit. I was hoping to have the results back and get it into the packet for this month, but we got them Friday night by about 4:45. So I will bring them back next month, but there are no findings. So, and then as far as the budget, we are where we're supposed to be for this time of year. Everything's on target. So that's all I have.
Questions or comments from the board? Thank you. Dr. Tomaso?
Sure. So I just wanted to give some education on avian flu as requested by Joe, and happy to do so. And in the future, if there's any requests for education, I'm more than happy to provide during the meeting. Or if there's a topic, current health topic, I'll just go ahead and prepare and present if that's okay with the board. So avian flu, cattle flu, cow flu, has many names. Also influenza D, H5N1, also called HPAI, recently named, which stands for highly pathogenic avian influenza. So maybe more names to come, but those are the ones they have so far. So an article from NPR from March 2023, which I found pretty educational, just on the background of the avian flu, although just of note it is from March 2023. Basically, in 2011, an Oklahoma farmer recognized that his pigs were getting sick, and he enlisted a vaccine scientist, someone to supply him with some vaccines, and the scientist ended up studying, and he discovered this new strain of flu, 2011. Immediately, this scientist had a concern for the zoonotic possibility of this vaccine, of this virus, and there are very few illnesses that we recognize as being zoonotic, although what they say is that there's probably many, many, many more. We just haven't been looking for them, so.
Zoonotic.
Oh, so can pass
Humans to
species.
animals?
Yep, interspecies transmission.
I knew, I was asking for you.
I was definitely not consulting our other physician sitting right here next to me who could explain that definition to me at the same
I
time.
saw Dr. McGuire whispering, I started, she tells me, I'm like, sorry to interrupt.
I was gonna say what it was too, so.
But I needed to know.
Yeah, I just had to put it in my notes, so I was gonna make
No.
Anyway, and they say that as far as human viruses, that doctors only ID 40% of what viruses come through, which I think is a huge gross miscalculation, because I would guess we only identify maybe 5 or 10, if that. Because basically, if you're gonna identify somebody's cold virus, there's this panel with like 15 different viruses. It costs a lot of money. It takes time to get back, so clinically it's not relevant and it's a waste of resources. So basically, if we're identifying someone with a virus, clinically it's because we need to know because they're critically ill or for some other reason. So yeah, most of the time we have no idea what kind of virus people have. So that being said, that means the avian flu could possibly have been around longer than we think. And they checked out all the cattle and see, they did a study and they tested antibodies in the cattle. They found that about 50% have antibodies to influenza D that's in the United States. They studied the virus. They found it's incredibly stable. It can survive high temperatures and acidic environments. And they even found it in the air in some US airports. So, yeah. 2019, 2020, they did a study of dairy farm workers. They found 2/3 of them were positive for antibodies for the avian flu. And then another subsequent study found that 90% did have antibodies. So that demonstrates that they've either been previously infected or previously exposed. And I didn't know this, but flu antibodies stay in your system for 18 months to 5 years. The avian flu seems to stay for about 5 years. So that means it's detectable on a serology test up to 5 years. However, your antibodies only provide immunity for about 6 months. And that's true for all flu viruses. So that's why we get our flu shot every year, because you get the antibodies, but they don't stay active for longer than about 6 months. So in contrast to the 90% or 50% of the dairy workers that were positive for the virus, in the general population of the US, only 18% were positive. So definitely shows that cattle is definitely a vector for this bad boy. Huge potential for adaptation. It has a long gene sequence, lots of areas for mutation, so similar to a virus that we know and love very well. And they are keeping this very strongly on the radar because they do have a feeling that it has the potential to become like the next COVID. So, like Susan said, they very diligently watching what happens with the next. And there is a vaccine being developed for it. Cambridge Technologies is currently developing one. And like I said, this is from 2023, but I couldn't find whether they had what stages of development that is at this point. So, and basically, just to summarize, as far as the background, they point out that the attitude toward coronaviruses before COVID was very kind of cavalier, where we just thought coronaviruses are just common colds. We don't need to do a lot of research. We don't need to come up with a vaccine. And then we all know how that turned out. Just some medical information. So basically, H5N1, all flu viruses have an H and an N protein. The H protein basically mutates when it moves from wild birds into poultry, into a more pathogenic virus. So basically started in Asia, found first in domestic poultry. It is endemic in Asia in the bird and poultry populations, so it's been around there for a long time. And they found 800 human cases in 19 countries worldwide. And then this is super, I started this and underlined it. No human-to-human transmission appears to be of concern. So they have not found any evidence of sustained human-to-human transmission. And that's from UpToDate, which is, physician database that you have to subscribe to. Really quick, so cattle first discovered in March 2024 in Texas. They're not exactly sure when it jumped from cattle to cattle, obviously it came from bird to cattle, they think starting in December 2023. And then, almost done. So, they have found the presence of the virus in some of the milk supply that's publicly sold. And as a result, dairy farmers have been asked to implement precautions, and those include limiting visitors to the farm. As far as their new stock that comes in, they're either asked to limit them or to quarantine them. They're asked to disinfect, and they're asked to report any symptomatic animals and symptoms themselves. And then they have not detected any avian flu in Illinois since they started this protocol reporting since late April. So let me back up. They instituted this protocol for farmers to report, and they have not had any positive reports since late April. Has not been found in beef cattle yet, only dairy cattle. On March 8th, they had the first confirmed human case in the US, that was in Texas. And then the current risk, they say, is low, but like I said, the CDC is monitoring it very closely, monitoring the wastewater, and supposedly a wastewater report is forthcoming. And sorry, so this last article was also from NPR, May 2024, so that's all probably as current as you're gonna get for that stuff. So.
I have a question. So I remember, and I don't know if it was H5N1, but the morbidity was high in East Asia, in the Asian countries where it's endemic. And is there a difference between those that are derived from birds or fowl and the morbidity between cows and humans?
Well,
it seems like it's a step down.
Found that H protein mutates when it transfers from wild birds to poultry.
Okay.
As far as from the strain that's carried by the cattle, I don't know. I didn't come across that in the literature.
Because I remember reading that case was very mild, he had like conjunctivitis or something.
Right.
That was it. So they're just waiting for it to mutate.
Yeah, hopefully.
I have a thing over my kitchen sink that says whatever it doesn't kill you now mutates and tries again.
Right. Especially viruses, yeah.
Wash your hands.
Did you say that it does not transmit from human to human?
Not that they've found it yet. And it doesn't seem to have the ability to based on, its properties.
Okay, but it's
and
been
that's
mutated.
above that is above my head.
Right.
I'm not a virologist, so.
So you get it from cows or you get it from chickens.
But as of yet, not from another human.
So how have they, obviously it can be devastating among the cattle populations. In certain places where it is endemic, how are they controlling for, if it's not human to human?
It's in Asia, so who knows?
Okay. I just feel like, here, it seems like,
What are we doing? Yeah, so, I mean, we have the protocols where the dairy farmers, are required to.
Their wastewater and their milk.
Report, and then, new stock that's brought in, they either have like a quarantine protocol or something like that, disinfecting and limiting visitors to the farm and stuff like that, so.
Right, because I mean, I'm not trying to undermine it at all, but it seems like it would be something that is a little easier to perhaps quarantine and control if there's no
Since
human
there's no
for
human
now.
to human, but however, it can be in the milk supply, it can be in the wastewater, and they found it in the US airport, so.
Yeah.
And so how does 18% of the population have it when they tested, like, is it 18% of like an urban population or?
They just said general population.
Oh, what is it?
Yeah. Which is amazing, it's like you can't, it's there.
Yes.
I just wanted
Have
to
they
add
tested
one,
the antibodies?
Okay.
Yeah, which we don't typically test people for flu, really just research purposes, because I mean, everybody's been exposed to just, flu A and B, so.
Director Hall's got some information to share with us.
I was just going to add 2 points to that. One is that worldwide, they have seen it in some barn cats. There was an incident in Michigan with barn cats, probably because of the milk, probably getting into the milk.
Raw milk.
Raw milk. And then the other would be, there are some maps that show you where they have had positive cases in wildlife. So for example, in Wisconsin, the red fox. We didn't have any here in Illinois, but some of the surrounding states that we know of, right?
So it's species to species, not just cows.
And although this virus is transmissible in the milk of cows, what about the eggs of
I don't know that they've
poultry?
tested them yet, but I could try to find out.
I did know that they had a huge.
Yeah, no rock.
I'm dairy-free as of 8 minutes ago.
In regards to milk, it has been detected in cow's milk. And the virus is killed by pasteurization. So the risk would be if you were drinking raw milk. Pasteurized milk, the science to date says there's no risk with the pasteurized milk.
Didn't they have a big turkey outbreak this past year?
They had a number in the poultry. They handle poultry differently. When poultry comes down with it in the flock, they are euthanized, the whole flock. Cattle are not doing that. They are monitoring and testing. The animal seems to overcome the illness in a short period of time and return back to normal production. Our dairy farmers here in McHenry County are having to go through additional steps to move cattle off their farm to the next point of sale, in that they have to notify, I'm not certain of the agencies, but they have to notify outside agencies. There may be required some testing, and the termination location is handled differently than it has been, for the last 50 years. In our county, the dairy farmers are being affected with the movement of animals.
I saw my kid was a virologist, and he was saying that he was going to Wisconsin to check out something with red foxes, and I did not realize, I didn't put it together. That's a shame.
Director Karras has a few comments to
Yeah,
make.
and just to piggyback on they did identify it in 2 cats in South Dakota. I just read this in an article today from the University of Minnesota, where there was no contact with any dairy herds or anything like that. So, but it's probably because they're testing more and identifying.
It's probably been around longer than.
They ate a bird.
Nobody would have ever thought.
You and I need to
But I also want to make the point. I also want to make the point that you don't get influenza from drinking raw milk. It's the aerolized of that milk. So, and pasteurization does emasculate.
You mentioned the vaccine. Is the vaccine that's in development for humans or for the animals, for livestock?
Humans, and like I said, that was from 2023, and I couldn't find current whether it's what stage of development the vaccine is in, but try to find more.
I thought Madison was doing something with the cows, but I don't know for sure. For that in passing.
Yeah, Cambridge Tech is developing it.
Any further questions or comments? Thank you, Dr. Tomaso. Next item is the consent agenda. Barb?
Move to approve the consent agenda.
Second.
I should have asked before we started, does anybody want anything removed off the consent agenda? Any comment from staff in regards to the consent agenda? Okay, roll call vote. We have a motion made by Dr. Amsler, second by Ms. Gaffney, and a roll call vote, please.
Dr. Amsler,
Aye.
Ms. Gaffney,
Yes.
Mr. Markison,
Yes.
Ms. Altough,
Yes.
Ms. Morowski,
Yes.
Dr. McGuire,
Yes.
Dr. Katz,
Yes.
Ms. Ortiz,
Yes.
Ms. Clark,
Yes.
and Mr. Clark.
Yes. New and unfinished business, item 7 on the agenda. 7A, resolution to reclass and retitle positions in animal control.
So,
Mr.
yeah,
Staff?
so as Mary Ellen mentioned, this is happening outside of the compensation and classification study that we'll talk about next. Just kind of due to the timing in part, because she's going to change some positions based on what she needs to meet her operational needs. So I'll kick it over to Mary Ellen.
So outside of the compensation study, we did have a position that had CPQ because it had been a union position that switched over to non-union.
CPQ means comprehensive position questionnaire, which is the process the county uses to grade positions. So it's a very thorough,
intense
15-page document basically that you have to describe the functions of the position, percent of time, level of responsibility, et cetera, et cetera.
Yeah. So I had one position. I no longer have kennel techs. I've never in the 8 years I've been there been able to keep a kennel tech for very long. We had switched our officers over to doing some cleaning in the kennel, which has been working fine, but there's a lot of other functions in the kennel, from adoptions to relinquish to assessing to behavioral. I can go on and on, surgeries, things like that, that we just need more kennel tech, vet tech experience to be doing some of those. I don't need a full-time position though. I have a lot of needs in the office that are reflective of the kennel. Taking in those strays with paperwork, doing that adoption paperwork, looking at some of the data, working with our volunteer coordinator, but also assisting in the kennel. So I took the officer position that we hadn't filled yet. As you know, I have 9 people who have been there for less than 3 years, most of them less than a year. So we really needed to get some of our needs met, which was some office, administrative work, and some kennel work. As you know, as you might remember, I have 2 managers. I have a field manager and I have what we call an internal operations manager. The internal operations manager oversees the office and the kennel. I have an admin coordinator that is under that person in the office. Now I'd like to have a kennel coordinator in the kennel. That just makes more sense with title, with functions, with all of that. So I'm taking that lead kennel, because again, I have no other kennel, turning that into the kennel coordinator, adjusting some of those functions so they're spreading out the responsibility, and then taking that ACO and meeting that need I have in the kennel in the office. I think that'll be a good fit right now. I think that fits with some of the things that we're working on going forward. Definitely fits with our renovation choices. I mean, there's just a lot of things that make this at the right time and what we need. Changing all those kennel people out, it doesn't work. We need someone who has some designated time in the kennel, who can, for succession planning, learn the surgical components, learn all the administrative things we do with a kennel, learn the transfer from an intake animal to an adoption animal, and the process in between there. So those are the 2 positions that I'm looking to. One, I'm taking another position, totally regrading it. The other, I'm taking that kennel person and just looking at the functions they're doing.
How many employees do you have, Mary Ellen?
21, I believe, including these positions.
What, do we know why the attrition rate is so high, or is it something that needs to be looked at?
Well, I would tell you way back when it was so high because the pay was so low.
Oh, okay.
Yeah. So as we've gone through the CPQ, some of those positions have increased in their grades. We've really looked at that liability, the functions, and have been able to pay our staff more. When Melissa gets into the comp study, I mean, one of the things is, paying office staff, administrative specialists, and our officers, their professionalism increased, their functions have increased and their pay has increased. Yes.
Do you anticipate the reclassification will lead to it being filled? Because is that
I think it's a
option?
lot more likely for it to be filled. We do actually have someone internal who has been doing some of that help with the kennel.
Oh.
They may be interested, I don't quite know yet. I think it's gonna be a lot easier for us to fill a vet tech who could do some administrative work like they do in a lot of the animal hospitals than to leave that position open right now.
Thank you.
Okay, I'm looking at the resolution. I was looking at the resolution, there it is. And it doesn't identify the titles of the positions that you want to change.
It should.
Right,
So the lead-
This is the resolution I'm looking at. Is there another one in the packet?
I've got one here that says it goes from lead kennel technician to kennel coordinator. And animal control officer to internal operations specialist.
I just don't have the correct form in front of me, sorry.
Is that tech position, is that like a certification from?
Here. I would prefer to have a vet tech certification.
It's looking at my
There
phone.
may be
No,
opportunities
it's fine,
that
it's fine.
someone has had enough
Okay, as long as it's
experience
here,
that they don't
that's fine.
necessarily have to have the vet tech. But that would not be my desire because they would have some natural instinct towards the medical components of it.
So would there be a possibility in maybe in the near future where if somebody got hired into that position, you could say, you know, we're gonna send you to vet tech school or whatever?
Actually, if the internal person was interested, I really don't know yet, then we would be sending them to the vet tech program. They have one at MCC.
Did you say that the new position will be part-time?
No, this new position would be full-time.
Correct.
It's just that it's some components of office, some components of
Would a board member like to be recognized in regards to this topic?
Sure. I'll make a motion to approve a resolution adopting the reclassification and title changes within the Department of Health's departmental roster.
I'll second.
I'm sorry, who seconded? Thank you. Any questions or comments from the board? Everybody's good? As this is a motion's been made by Mr. Markison, seconded by Ms. Borowski. This is a financial issue. We will do a roll call vote, please.
Mr. Clark, I believe, Ms. Hamsler seconded?
Actually,
Oh, she
you,
did. Okay.
you double second.
You said there was a double second. Okay. Mr. Markison?
Yes.
Ms. Morowski?
Yes.
Dr. Amsler?
Yes.
Ms. Gaffney?
Yes.
Ms. Althoff?
Yes.
Dr. McGuire?
Yes.
Ms. Ortiz?
Yes.
Dr. Katz?
Yes.
Ms. Clark?
Yes.
And Mr. Clark?
Yes. Next item is item 7B, compensation study.
So, as a reminder, the county, since the last, I think it was in 2022, that they agreed to start doing a compensation and classification or classification compensation study every 2 years. So we're up again. They have just gone through the process. What they do is they take from, you know, I think there's what, 1,100 employees or something. I can't remember how many positions there are within that, but there's quite a few. In fact,
Like 11 classifications.
but there's, well, and there's 22 grades. But
Right.
basically what they do is they send out positions that they're looking particularly to look at to see how they fit across the market and across the region. So they send out these questionnaires to get information back, and that's how they begin to make decisions about whether or not to adjust the scales and how McHenry County fits against the region. So they just completed this process. This is actually going to the county board tomorrow for approval. So what I did today that's not in your packet, you have in front of you just a summary of the changes and how they impact us. So the resolution itself for the entire county was included in your packet. The Board of Health does not necessarily approve this, right? It's going to be the county board that approves it. But I wanted you, so what's in the resolution is showing you the impacts to the total county. What I printed off for you is packaged up what those impacts look like for our department. So outside the one reclassification you're doing tonight that you just approved, we had one reclassification / grade change through this process. We had 53 employees who needed to bring up to the minimum. So those scales moved. And as a result, so somebody could have been at the minimum on the current scale, right? We hire people at the minimum. There is one exception right now. We have the ability to hire somebody under minimum if we're interested in hiring them as an employee, but they don't meet all the qualifications of the position. Once they meet the full qualifications, then we bring them up. So we've done this a couple of times. 66 people received adjustments for years in position. So what the county does with this mid-market, that's really the goal, as I understand it, for the county, is to assure that their wage scale is meeting the market demands. However, we have people, we had 16 employees who are currently at or above the mid-market, so they didn't get any adjustments despite their longevity. Does that make sense so far? Mm-hmm. Okay. So I provided you what the current pre-wage scale changes are in terms of where our employees fall. So the first column with the minimum shows everybody. So right now, there's 107 people who are, and I also took out the summer interns, by the way, just because it makes it a little less complicated, but they will be paid at the new minimum. But once you get into the first quartile, we only have 31 employees who are in the first quartile, then 20 employees, then 1 in the third quartile, and nobody currently at the maximum. So, and I have more detail, but I don't want to overwhelm you. I just tried to give you a summary. So once the adjustments are made, and the adjustments take effect on July 1st, then we have go up 1, in the first quartile, so 1 more person will enter the first quartile. We actually go down in the middle, and that may seem like a quandary to some. It was sort of a quandary to me until I looked into it further. And the reason for that is that people who were hired in, or changed a position who've been working for the department were started at a higher rate. So they're further along on the scale. And if their current rate is higher than the year in position calculation that the county does, you go with the current rate, obviously, because it's higher. So then I wanted to give you just a snapshot of what the future looks like. Merit has not been decided yet, but I projected it out at 3.5%. So we see a tiny bit more movement after merit, which will be July 1. So just to kind of highlight some of the limitations and or considerations. So the years of experience, again, it caps out that calculation, that adjustment that the county uses, which is their market middle, it caps out at 10 years. So if you're already over that, you're not getting any adjustment for that. So that can create some compression further, up on the scale. And then just the county really doesn't have a system for longevity. And that is just a fact. The merit scale, when it moves, it's going to move by half of what the merit is. So if the county approves 3.5%, then the merit would be, the scale would move by 1.75%. And the pool of merit, just to reiterate, that we get is based on filled positions. So we don't get a merit pool based on all of our positions in the department, right? If it's a vacant position, we don't get merit for that. So that can create some challenges if we work on a performance-based system. The county, the Board of Health has chosen over the last years to take whatever that merit is and use it more as a cost of living, right? And everybody who's at least meeting the minimum of their performance is getting that amount. But that then means we don't have the ability, we don't have a pool of resources to reward people for performance. Now, some of the ways that we have tried to be creative within the county system is create some step systems. So for example, in environmental health, we've created a step system for the environmental health practitioners, and now we've done it in animal control for the animal control officers. So what that means is as they have increased responsibilities, they take on more complex work, we can move them in and kind of reward people for performance and taking on new responsibilities. So that's kind of how the system exists right now. And I know there's been lots of conversation in the past, and I just wanted to throw it out to see, you know, if board members had any thoughts about, you know, any recommendations, but this is the system that the county currently has. And if you, you know, we've talked internally before as, you know, how do we reward performance? How do we keep and retain employees longer? You know, what mechanisms are in place for us to do that?
Questions or comments?
I had a question, and I didn't see it, so Sarah, I apologize. What is the financial impact?
Oh, I'm sorry, the total amount. So the annual impact, I believe, is $198,000. And then, so through the 5 months of, so there's July 1, there'll be 5 more months in the fiscal year. Hold on, instead of unhiding columns, I hid them. So the 5-month projection is, before FICA is just over 81,000, and then with benefits, it's about $92,000, $93,000.
And I know you probably don't have the number, but how does that compare to last year?
That number I don't have off the top, but I could certainly
I mean, I didn't know if it
You mean
was a
the
trend, or
last?
is it an outlier? Is it something that's huge that all of a sudden, you know, we're getting a wave of people that are aging up in the system from a...
Okay, I think you're asking, I just want to make sure I understand your question, because I thought the question was about like, what is the financial impact? But are you asking more about like long-term?
Well, I was looking at the financial impact, and then we do these assessments each year.
Every 2 years.
Every 2 years, so
Yep.
I guess for the last time that we did it.
So the last time, I think it was more expensive because they moved more people over. And that 10 years, I think they gave a maximum of, if I recall, $10,000. So they did not, this time, I don't think they maxed.
There was no cap?
There probably was, but we don't have that in our department.
Okay.
And it's not listed in the resolution, so I'm sorry.
No, that's all right. No, I was just curious of the financial impact. So you're right. I was just thinking, I forgot it was 2 years and not every year.
All right.
Oh,
go ahead.
Ms. Amsterdam.
This actually is a question for our board representative. Is the county interested in longevity in its employees? And does it have a mechanism to promote that? Sorry to put you on the spot, Pam.
I don't want to be the one who answers that question. I mean, if we want to really, I would suggest, and I've said this before, if we really want to have a meaningful conversation about where you want to go with compensation, whether it be based on performance, et cetera, I would ask in county HR to answer those questions and have a complete, perspective as opposed to coming from me. I would just rather have Cheryl or Susan come in and answer all your questions about what they do, how the departments work.
Can I ask you, do you get a sense from the meetings that the county would like to make longevity an issue?
We have been talking about that specifically with regard to union contracts. But it's not significant, I will tell you that.
There's no move to
enhance. No, and this is my standard answer I give people without getting into trouble. We presented a budget and have different scenarios, and the one that was recommended by the finance committee, where we could take a 5% increase because of inflation this year, so we got to take the max if we wanted. And we presented a budget where we took 1.9%, and it barely passed. So read that in the way you wish.
Can you tell us county-wide, do they have an issue with
what?
Maintaining employees?
They did, which is why we then went and did the comparison study and why we're doing it every 2 years. We were losing many employees who would come to McHenry County and be trained, whether that was in law enforcement or whether that was in like McDOT, mechanics, et cetera, and then go to Lake County or Kane County where they paid more. So then they went in as experienced. We have offset that now by evaluating what's around us and what the standard is for specific skill sets. And we're very competitive now. So we have not, and we also are filling positions a lot faster than we were before.
This is informational.
So I for one am grateful to see the compensation studies. I know we've talked about compensation for years here, and those are good things. I'm glad we're seeing that come out. I'm glad we're gonna see people get rewarded for their time and effort. I think longevity is an interesting topic unto itself. Different organizations handle it in different ways, and the idea of like golden shackles, where it's like, well, you're gonna pay more, but now if you leave, you lose out on that, which is, what keeps somebody there. My question pertains to, do we currently have, I feel like I'm oddly unfamiliar with exactly how this should be, between like the same position across all different divisions, let's say.
For departments, do you mean across the county or in?
No, within health department.
Okay.
But I guess it could take it, extrapolate how you like. So just want to understand, if it's the same grade, let's say, like an accountant one, or no, administrative specialist, or something that you would have in environmental, public health, veterinary, if you had the same one, would they be paid the same, regardless of the number of years they had there?
Okay, and I might not understand your question fully.
I'm not sure I understand it.
Okay, so.
Yeah, I got lost about halfway through.
I got it.
I guess, is there any growth in that?
It is based on years of service.
Part of it is based on years of service.
Okay.
Right? So somebody who just starts, right, we have a minimum that we can offer. However, the salary administration policy of the county does allow for variation, right? So people aren't exactly at this, most people within the grade are clustered together, right? But if somebody who comes in with a ton of experience and has all this background, we don't have to start them at the minimum, right? So they're starting a little farther up on the scale. We can, through HR, I think it's 4%, like they can approve up to 4%, and then the county administrator can approve up to 6%. Past that, it has to go to the county board via resolution to ask for more money,
Okay, so we're looking at these salary ranges, minimum, midpoint, and maximum. Is there a set percentage?
And are those salaries, and I apologize, I need to ask, are those salaries inclusive of benefits, or are those a straight hourly salary?
No, these are straight
Take that into
salaries.
consideration.
Sure.
That's what we look at.
Okay, absolutely, and it
Yeah,
should
it's
be,
just the
it should be part of
salary.
everything, but is there a set, like a percentage between those midpoints? And do you grade, as someone who stays in their position as they go up, do they climb to those?
Yeah, that's a good question, and I meant to do the math between the
No worries. I didn't mean to put you on the spot. I felt like I
minimum
was.
and market. I can easily do that calculation. I wanna say it's somewhere around like 1.6, but I don't know if it's the same way all the way across, right? Because there's a 45% spread
Oh,
between top.
that's what I'm asking. There's a
Right, so-
45% spread
Yeah,
between
I
minimum and
mentioned that
maximum?
at the top, but,
I missed that, I'm sorry.
yep, so there's a 45% spread from the minimum to the maximum.
We
And
try
that's the
very,
same, sorry.
yeah, no, we try very hard to stay,
Mhm.
just, here's average, we try to stay just to the left of average. So we're a little bit higher than where we see, but we're still playing catch-up game.
Yeah.
We expended over $2 million to do the last compensation and get people where they needed to be,
Right.
which was a lot. And so we're still playing that catch-up game. So you may see that reduced somewhat, I don't know what'll happen.
So is the 1.9%, is that gonna keep us in the game so we don't have to go through this again? Or we're gonna be playing catch-up again?
That's a budgetary question I can't answer because I don't know what the board members will do or not do. But it puts us in a better position to do that catch-up.
But I mean, it wasn't even half of the 5%.
There's a message there.
Yeah. All I'm saying.
I think you were asking, like, is it equitable between the departments within the county as far as the promotion and starting salaries? Was that kind of what you were
It
asking?
was kind of a generic question. I wanted to see how you responded, how everyone responded, because
I think it's pretty equitable, don't
Yeah,
you?
I couldn't actually answer that without going to the posted salaries or to get more information, but I'm assuming that yes, because it has to be within the scale.
I'm serious. I really think, if it fits within the agenda, that you take some time and maybe we set one of the meetings for a period of time and we invite the county HR to come in and talk a little bit more about where we've come, what we've done, how they do it, so you get a better idea of the full county, and then we could have maybe a discussion with that knowledge behind us about what we want to do with regard to merit or whatever else we want to discuss. I just think it would give you the right perspective on where to go with that conversation.
there might be benefit in learning that for the sake, but I'm also reminding myself, like, my curiosity may be getting the better of me because we don't set the salaries for those employees, but it's interesting. And we always advocate for it, so I think there would be.
And we are very appreciative of that.
Does anybody have, excuse me, does anybody have any idea why they cap at 10 years? I mean,
That's what I'm saying. I think you'd get a better historical
I think that's kind of.
and understanding if you invited them in. I'm reluctant to.
Yeah, I don't want to misspeak, but the 10 years, as I understand it, is the market middle, right? So after that, they're applying that logic to get to the mid-market point, and then I think between merit, or taking on new responsibilities, maybe they're moving people farther along. But at 3% or whatever every year, if the table moves by half of that, and you get a full 3%, and the table moves 1.5%, right? So that movement is smaller, if that makes sense.
Mm-hmm.
I'd like to throw out a comment. Various governmental employees have other schemes of paying their employees, salary structures, benefits, perks, et cetera. In McHenry County, they have chosen to use this format, and it's been a long established format. I certainly would agree with Ms. Althoff to conduct a special meeting so that this board can have a conversation with HR or finance and express our opinions and ideas to them on what some of our experiences have been in life and through our employers, and maybe share that with the county, and maybe they will consider some of the items. But what I want to hesitate from doing tonight or any time here is to pick and choose a benefit and say, we want you to give this benefit to the employees. Because when you pick and choose a benefit and then put the negotiators, the county, it establishes this protocol, you put them in a bad spot, because in order to implement this benefit, there's a quid pro quo. There's always a give and take. So yes, you might be able to put in a stipend program, but that might lower the midpoint of all the classifications. It has to, the people doing the negotiating for the wages have to come up with these programs. So I just don't want to go on record as endorsing one particular perk that maybe we had in our jobs and say that all the county people should have that without letting the negotiators do their thing. And it's clear to us, and it has been to me for a long time, that in regards to wages, the county has jurisdiction, and we do not have jurisdiction.
I'm sorry, what did you say?
It's been clear to me for a long time that in regards to wages and benefits, that the county board, the county administration has jurisdiction, and the Board of Health does not have jurisdiction on that.
We set one salary.
Correct.
Correct.
I would say it would be a good idea to have conversation, even if it's not our jurisdiction, for us to understand it better, and then that way we could, advocate, either advocate for the employees, but then also having our employees understand where the county makes these decisions and how they make them. So I think it'd be open to having a conversation and understanding it better.
Agreed. I wouldn't be opposed to the Board of Health having more discretion in the wages and benefits of the employees assigned to the health department.
And I would just say, if you're going to do that, I would respectfully request that you invite Tracy Von Bergen, who's the chair of public health. I think that would help you with advocacy and understanding.
May I have clarification on, I heard special meeting thrown out, or do you want this to be a future agenda item on one of our standing, could take up the whole meeting?
I'm requesting that we have a special meeting for this topic only.
For the whole committee or personnel?
I need another meeting.
For the whole board or personnel?
What's your thought on that?
I sit on personnel, so I would be in the meeting regardless. I'd be open, but maybe having it open to our board members to see who else would like to join.
And I think that's standard. You certainly can invite anybody, right? I mean, anybody can attend a committee meeting. So, however you would want to do that is up to you.
Just have a whole board meeting.
I mean, typically an item like this would go through a committee, but because of the
informational
interest.
The interest, the opinions of all the board members here, I think it would be best in a special meeting.
I agree.
Do you want a motion?
Let's see. Well,
no, you don't.
I can call a special meeting. So just work out the details with Human Resources and Finance and let me know, and we'll poll the board members, their availability, and set it. There was no further action required by the Board of Health tonight on this wage study. This was more informational. presentation so that you knew that this was coming down the pipe from county administration. Any more questions or comments? Okay, let's move on to the next item, which is board issues. 8A is bylaws. You want to comment or you want me to comment on it? Okay. There is a, in regards to the bylaws, I'm going to recommend that two items be referred to the Regulation and Ordinance Committee to review some language in the bylaws. One item that needs to be reviewed is the language in our bylaws in regards to attending the meeting via video conference. Actually, there's a little bit of a conflict in our bylaws. And then the second item, it relates to, as you recall, when we set the goals for Melissa last December, one of the goals was to come up with some program or some thing to reward or say thank you, good job to the board members for your attendance here. Once you become a member of this board, other than being able to express your opinion and vote, there is no recognition for you. She has been working with the county on creating a benefit for board members. It was identified that in our Constitution or in our bylaws, there is a sentence in there that prohibits any type of compensation. And so that item needs to be debated at committee level and hopefully amended so that the county can then do their thing and create a benefit for us. The county has requested that we do this, before July 1st, so that they can begin the process in their budget creating for the next fiscal year. So I am asking that this be sent to the Regulation Ordinance Committee, that they meet, they discuss this, and I don't know if the other ordinances would be appropriate at the same time. I'll leave that up to administration.
Yeah, I don't think it's a matter of appropriate. I think it's just a matter of timing and whether or not we'll be ready to bring them. So we may have to have more than one meeting.
Any questions? Okay, so that's that item. Item 9, information communications. You've got that in front of you in your packet. Thank you for Animal Control for your effort and good PR.
We're going to celebrate her next month.
Oh.
25 years.
Did Sam's just come to you with this, or do you have an outreach thing with the businesses in the area? I mean, was it Sam's that you said?
Oh, Sam's. I'm sorry, I couldn't hear what you said. They actually contacted us because they do a day of giving and go out to different organizations on that day. So they have different groups that do that from different Sam's clubs. And we had done our first one last year and they want to come back again.
Item 10, executive session. Item 10A, approval executive session minutes. I'm removing that from the agenda as we discovered a change that needs to be made, so we cannot approve those tonight. So we do need to go into executive session in regards to the audit. Is there a motion to go into executive session?
So moved.
Sorry, who made the motion? Okay, thank you. And it was seconded by? Motion has been made by Ms. Althoff, seconded by Ms. Clark to enter executive session. All those in favor say aye.
Aye.
Those opposed say nay. Ayes have it.
So, give us a minute.
Mary Ellen.
Oh, okay.
telling us that you're ready.
Oh,
Okay, we are back in open session, a roll call of members present in open session. Joe Clark.
Cindy Gaffney.
Pamela Altough.
Barb Amsler.
Julie Morowski.
Kyle Markison.
Lupe Ortiz.
Sarah Clark. Kristen McGuire.
Okay. Item 12 is the appendix. You have a report from all the departments on their statistics. Any questions on the reports?
I move that we adjourn.
And 13 is adjournment. Motion has been made to adjourn. Ms. Gaffney, who's in second? Ms. Dr. Amsler seconds. All those in favor of adjournment signify by aye.
Aye.
All those opposed say nay. Ayes have it, we're adjourned.